Good afternoon, everybody. This is Ask Me Anything. I'm Dustin Strong, and this is Strong on Health, and this is where we answer questions when it comes to your health. Any questions that you have been emailing us or asking us, or those questions I get commonly asked, I try to make sure that they're publicly available to you. So this is our service to make sure that we're sharing what we're learning and what we're sharing with our clients when they come in here. We have a list of questions here that people have sent in, but before I go into those, I do want to speak really quickly and just do one little thing to remind you all, when you are being given medications, to make sure you're checking the side effects, because oftentimes when we're talking to people and they're coming in, they're complaining of a lot of different things that are bothering them or that they're struggling with. The first thing that we will do is we'll say, well, let's look at medications and see if there are side effects, and there are almost always going to be some correlation there. So you do want to go back to that first instead of trying to correct it with something else. Make sure that you're looking at, are you taking something that that is known to be creating this condition, and then talk to your doctor about it so that they know, because oftentimes there's a lot of these side effects that are on there, and it isn't always perfectly communicated when you're getting those medications. So it is up to us to make sure we're looking at those and understanding them. We've had a lot of people who have come in with certain complaints and that found that to be the number one thing, that all the things that they're complaining about are all the things listed in the side effects. So now they have that information that they can go back and talk to them. So always, 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 no matter what you're being given, check for the side effects, especially for the known side effects, and then rule that out first before you try to look outside of that, because if it's known to do that, it's pretty likely that that's a part of what's going on there. And another thing I want to talk about was testosterone. We have so many people still thinking that once you hit a certain age that you just can't produce testosterone, and you have to go in and get these testosterone shots. So it's very concerning, because there is a lot that happens to that testosterone after it goes into your body. Yes, it can make you feel great, and we need testosterone, but it doesn't stay as testosterone, and I always try to remind people of that. It's going to get converted. It's going to get converted most likely to estrogen or to dihydrotestosterone, both of which you need to be mindful of, and understanding that if you're putting more and more and more testosterone in there, you're going to get more and more of one or the other of those, and you have to support your body's ability to eliminate that. So the things that people are complaining about and they're getting resolved by that, we have to think about it in a different way. We have to understand, first of all, why is that testosterone getting lower? And age isn't necessarily the reason. There are a lot of things that contribute to that. Vitamin D levels, magnesium levels, whether or not you're getting enough healthy fats, whether or not you're using those healthy fats. There are many, many, many things and questions to ask before continuously dumping more and more hormones into a situation that you don't necessarily know. Now, some people say, well, it's okay, I'm taking an estrogen blocker. They gave me an estrogen blocker. Well, this is another incidence where it's really important to look up the side effects. The individual who had showed us the side effects, it was actually, when we looked it up, it is classified as chemotherapy, and so the different things that they were struggling with were definitely associated with the side effects of the estrogen blocker that they were taking. So look those up. Don't just think that it's something as simple as just throwing in testosterone and an estrogen blocker. Make sure you're thinking about what nature has to say about it, and being respectful of how nature is going to help you process those things out. Okay, so those two things I just want to mention really quick. And so someone's asking me to talk a little more about the heart scan that I went and had done. So a couple weeks ago, went to Methodist Mansfield and had a coronary artery calcium score done. It's a very simple procedure. It took just a few minutes. And what it does is it gives us information. And the more information we can have about our body and our health, the better off we can be. And heart attacks are the #1 killer. And so this is a very important organ to keep an eye on. So what we're looking at with the calcium score is the amount of damage really that's been done to the coronary artery. So when there's damage to the artery, there are certain things that your body does to respond to help repair that. You've got cholesterol, but you also have calcium. And a lot of times people can have really normal cholesterol levels, but they're still getting a lot of calcification, and the calcification can create the heart attack. And so you have to be careful of being blocked by calcium as well. It's very simple to go in, see how much blockage there is in there with that calcium, and that just informs you and gives you a lot more information about one of the most important factors when it comes to your health. So I went to have that done. I'm probably a little young to actually have it done. Usually sometime around your 50s is probably where you're going to get suggested to go get that done. But anybody who has any concerns about their heart health, anybody who has any history of that, it's worthwhile information. So I don't really necessarily think that there should be a limitation on how old you have to be to go get that, because due to the conditions and all of the stressors and all of the things that are affecting us as Americans, these things are happening at younger and younger and younger ages. So I can't really say, as they're asking for age, gender, family history, heart problems, I think if you're an American and you've been living an American lifestyle, at some point it's really good information to just understand it. And it's really not a hugely expensive procedure, and it's a very simple procedure. It takes a little bit of time and gives you so much information, such powerful information about where your health is at. And if you do go and get that done and you do find that there is a lot of calcification, that's when you're going to ask us another question about what can you do about it, and we can definitely talk about the ways that you can approach to help with the calcification, okay? But definitely worthwhile for anybody who has any concerns about their heart health, and I think that would be anybody who's living in a country where we have a heart attack every minute. So I do believe it's worthwhile to have that done. Okay, intermittent fasting. I do it fairly frequently. I was wondering if taking supplements while fasting breaks my fast. I know there are not a lot of calories, but you can never really know how many calories actually breaks the fast. That's actually a good point. And to be safe, I would say not to take them in your fasting window, just to keep them in the window that you are eating if you're doing intermittent fasting, because it can. Obviously, anything that is going to turn into glucose can do that. Any carbohydrate, any fat, those things are going to be breaking the fast. So I would just keep those within your eating window just to be safe. And then finally, and I think this is a joke, I hope this is a joke, what do you think of these all-natural taco shells I found? I love the texture, but they don't have much flavor. Side note, I don't have any friends to share my coconut chips with. I'm sure, you know what, if you open that, you'll find some friends to share them with, because I'm sure they're really good. Guess I'll have to eat the whole bag myself in one sitting. Well, you know, it's the choices we make that determine who we are. The healthy taco shells are romaine hearts, so it's lettuce wraps, and I think that's what you're telling me. Yes, it's a great option when you're making tacos to wrap them in lettuce. And I hope I'm answering that question right, but if not, maybe we got the wrong picture. But yeah, great choice. So this is a great choice, obviously. So balancing that out with eating the whole bag of coconut chips, you know what? It takes balance in life sometimes. All right, keep your questions coming, guys. We have a lot of great things happening. We actually already have 5 restaurants that we have prepared the healthy selections for the Healthy This Way menus. And so keep coming in with those restaurant selections. If the restaurant is not somebody that we have spoke to yet, we want to make sure that we're reaching out to everybody and making sure that this is available to anybody going to any of these restaurants, so they can walk in and see the easiest top 3 healthiest choices on the menu. And we're going to be giving the information as to how we're selecting those menu items and why we're selecting them and what makes them the healthiest. So really excited. We're going to hopefully have all this wrapped up by September, having all of the restaurants that are going to be involved in that, so that we can get them announced, and then we can get them all completely on board by 2020 for the 2nd year of the Healthy This Way initiative, so that we are getting this healthy information out to anybody who's sitting down at any restaurants in this area to know what can be the healthiest choices. All right, thanks for watching, guys, and we will see you next Tuesday at the next Ask Me Anything.